So today we're doing something different. We are using Renuvion, formerly called J-Plasty, and we're going to treat underarms. So the reason we're doing this is because our gentleman here feels he sweats too much.
It's strange when my body decides to release moisture. I sweat, like I run a couple miles, I don't know, 15, 20 miles a week, and I sweat like I normally would, but then I'll be on a phone call, and I pace when I'm on a phone call, and I find myself sweating, and it's like not strenuous, but it's just really bothers me. And then I'll have to leave the house and I have like a sweat stain.
So we're gonna go in and heat all those sweat producing glands and hopefully destroy them with the heat so he produces less sweat permanently. So I know a lot of people get Botox for the underarms, even for the palms of their hands for sweatiness, which works great, but it only lasts 4 to 6 months. This, if it works the way we hope it will, since it's the first one ever, it'll be permanent.
I want to really present my best self forward in every professional and personal scenario, but then also in business meetings too. And I don't want to show that I'm stressed out and I have sweat and then I spend a lot of money on nice shirts and then...
So first I'm going to numb. So we're going to take this, and this is full of a tumescent solution. It's lidocaine with epinephrine with a little bicarb, take out the sting, mixed with saline. And that will numb this area so we can treat it comfortably. Here comes the first pinch.
I've never had anything, like I had my wisdom teeth out a year and a half ago, I'm 40. I've never had anything, not cosmetic, not therapeutic, so I'm really excited. And I'm not even nervous at all. He's about to stick something under my skin and like I'm just excited. I don't want to watch, you're probably gonna have to hold my head steady.
So our patient A wants to do selfies, so he's gonna hold the camera to film himself. Yeah.
I'm so excited.
Okay. There you can see. So that is the energy that's going to be treating the tissue inside. So I am now pre-tunneling. This is just creating passageways for the device, because the device isn't very good at passing through the tissues without getting clogged. So we do this first so it can continue to function. And I'm going very superficial here because we're treating that layer just under the dermis or under the skin. So I'm just making sure everything is as loose as it can be.
This feels like
pressure.
Yeah, it's just pressure and a little grinding sound that you can...
Yeah.
So I felt a little poke at the
most extreme.
At the extremity.
Yeah.
My first up 13.
So will this make his armpit area very skinny?
That's right.
It will.
Maybe become an armpit model.
It will probably shrink the tissue up to the in his armpit a little bit. You can see the light under the skin.
I don't feel a thing.
Okay, and again.
Yeah.
So now what I'm doing is rolling the tissue to push out any extra gas. So the helium can get trapped in the tissues. Of course, some fluid comes out too, which isn't a bad thing.
Everything's done. I'm excited. I just hope it works. I mean, there's reason to think it's going to work, but I had no discomfort at all, and I don't even like feel fine. I could play basketball right now. So.
But you probably shouldn't.
Oh,
not right now.
Let me call my friend to cancel. No. I've been thinking about doing this for a while, and I was just thinking, okay, I'm going to do the Botox thing, and I'm going to have to go in 2 or 3 times a year, and you know, however much that costs for the next 40 or 50 years. But this is one shot and it's done. And I'm so excited that I might never have to deal with this ever again. Oh my gosh, to be able to just go about life, like not sweating so much and just being like a normal person again, it just feels so, I'm really excited about the possibility of this working, and it was so quick and easy. And we laughed, we didn't cry at all. It was great.